My name's Karen Matijasevic.
And how long have you been a patient ambassador for?
Just over 2.5 years.
And what made you want to become a patient ambassador?
We retired about 2.5 years ago, my husband and I moved down here, and my background is nursing and midwifery, 40 years, and I thought I didn't want to quite give up my connection to the hospital and the profession, so I thought this would be a good way of, still having a grasp of it, or a link.
Would you recommend being a patient ambassador to others, and if so, why?
I think so, and you don't have to have a nursing or medical background to be of any use. In fact, sometimes being a layperson might be better in that you're objective. If you've got time and you want to contribute to the health service, which is, I think, one of the best things this country has, yeah, go for it.
George Allen.
And how long have you been a patient ambassador?
I started this year actually.
And what made you want to become a patient ambassador?
Well, I've always been involved with what I do is with meeting people, and I've been in hospital myself, so I know how people feel, and I thought to myself, well, get stuck in there and see, what you can do on behalf of the patients with their views, which I also base on things that you think of yourself and see what they think.
And how do you feel you can make a difference?
Well, hopefully, I'm looking upon it not as a staff side of things, but as an outsider, and listening to what they say, I feel that they're more relaxed and more open when they're speaking to somebody like us, rather than they would say to the ward sister or the doctor himself. And that way you can sort of liaise with them in a much more relaxed way.
My name is Fiona Roberts.
And if you could just tell me why you decided to become a patient ambassador?
Certainly. I have, for about 20 years now, I've had an ongoing spinal problem, and back in January of this year I became very, very ill. I lost the use of my legs for 4 days. Went to my doctor, and my doctor called an ambulance and it brought me straight up to the A&E unit here at Trelisk. And the treatment I received from the second I arrived, the doctor, the nurses, was absolutely phenomenal. And everybody was extremely kind. They were all absolutely above and beyond anything that I'd ever heard. You hear a lot of negativity when you're sort of going about your business in Cornwall. Don't very rarely hear positive things about the hospital. So I wrote to a lady in charge of A&E. I wanted to thank Dr. Roberts, I wanted to thank the nurses, and sometimes later I received a phone call asking if I'd be interested in becoming a patient ambassador. I'm a great believer in public service, and we should all give back if we can. I truly believe that being a patient ambassador, if I can help one person in this hospital or make one person's experience of the hospital better, that's fantastic. It's been really interesting. It's a side of life that I knew very little of, and to this point I've really enjoyed it, and I hope to become much more involved and contribute as much as I can.